introduction. So I'm very pleased to be here today to talk about paratuberculosis in Canada. It's such a pleasure to be in a great country like Japan. So first of all, I want to acknowledge the student who really did the work. I was just a collaborator on that study, but he was unable to come to the Congress. So Juan Carlos Arango Sabogal is the guy who did everything on this project. So since I'm the second presenter on the subject, you already knows pretty much all of it here. It's a contagious and chronic enteric disease of ruminants, and it's present all over the world, causing economic losses. And there was an increase in the interest for that disease in the past decades because there was some reports about association with human disease, so the Crohn disease in human. I want here to stress out the two main control points that we can do in our herds. So let's start with an infected cow that is not clinical, so she is not demonstrating any clinical signs, and she is a shedder in the herd, and she will be in contact directly or indirectly with the naive calves that is present on the herd, and that calf would become infected and join the club of the cows infected shedders a few years later. The other way to introduce or propagate the disease in the herd is to buy a cow, so you can buy the disease and introduce that cow in the herd, which will increase the infectious pressure. So we can play on those two ways to control, and if we manage it correctly, we will end it up with the healthy cow that will decrease the prevalence of infected cow and maybe the incidence of new cases also. So longitudinal studies are really helpful to evaluate the effect of the impact of control measures on the disease. It's the same thing for paratuberculosis. Unfortunately, since the incubation period is really long, several years for that disease, it's very costly to perform that kind of disease, that kind of studies. So there is few studies, longitudinal studies on paratuberculosis. Most of them are there on the screen, and they were performed mostly in the States and on a really different kind of farm settings than what we have in Eastern Canada. So they are done in large freestyle herds, and we'll see on the next slide that it's not the same thing in Quebec. However, we have learned things from those kind of study that prevention and control can be achieved by the implementation of strict control measures. So we wanted to have a look in our context in Quebec. So Quebec is the French part of Canada. We have the main dairy industry in Canada. We are producing approximately 40% of the milk production of the country. Our farms are smaller than maybe you are used to, 68 cows in average. Most of them are tie-stall herds, but this is changing in the last few years with the introduction of milking robots. And there was a voluntary program to control and prevent the paratuberculosis in Quebec. It was started in 2007, and it was stopped last year. But in 2012, the government have a look to their data across the herds that were enrolled on that program. There was 7% approximately of the herds that were positive. And among them, we did a study about the individual level of infection, and it was lower than 3% of the cows that were infected. So this is in the kind of setup that we are working with in Quebec. So our hypothesis for our study was to see if changes in management practices may reduce the transmission and the incidence of fecal excretion of MAP, even in small low prevalence tie-stall herd like we have in Quebec or Eastern Canada. We had 3 objectives. The first one was to describe the change of the incidence of individual fecal excretion of MAP in cows born before the implementation, the enrollment on the program, and the cows born after the enrollment on the program. Second, we wanted to determine the impact of the risk score assessment of MAP within herd transmission on the incidence of individual fecal excretion of MAP. And finally, third, we wanted to evaluate the impact of calf rearing management practices on the incidence of individual fecal excretion of MAP. The study design was a cohort study, and we use a cluster sampling strategy. So the primary sampling unit was the herd, but the unit of interest was all the adult cows that were in those herds, lactating or dry cows. We used some selection criteria. The first one was that the herd needs to be positive. So we set the maximum limit of 2 years. So since the last positive test, there needs to be a tie-stall farm. They need also to have a regular veterinarian herd health visit, at least monthly, and to give us access to their records and to have raised their replacement efforts on the same site. So a small time scale here to illustrate our protocol. The study period was from 2011 to 2015, but the enrollment of each specific farm was performed in the past from 2007 to 2011. We let for each herd time period a delay of 6 months after the first enrollment to let the producer have the time to implement the best practices that were recommended by their veterinarian. So that's the time 6 months after enrollment where we decided to divide the 2 cohorts of the cows born before the implementation of the enrollment on the program, and the cow born after, and we followed them afterwards. We did one sampling, individual fecal sampling culture of all those cows that were present on the herd every year. We did also a risk assessment questionnaire at enrollment, and we repeated it every year during the study period. Statistical analysis, briefly, we did the descriptive statistic. I will show you some, and some survival analysis, incidence density rate, and Cox proportional hazards model. To make sure that we are on the same page, some definition. Even was defined as MAP fecal excretion. Only the first positive fecal culture was considered. Censure happens when a cow was culled, a cow was found dead or lost to follow-up, or for sure at the end of the study period. And time at risk was the period elapsed between the beginning of the follow-up period until the event or censure. And we started the follow-up period at the first calving or at 2 years of age. So first, the descriptive results. We enrolled a little bit more than 2,000 dairy cows coming from 18 different farms all around Quebec. They were mostly Holstein cows, few Jerseys, few Ayrshire. And as you can see, there was approximately 900 cows that were born before the enrollment on the voluntary program and 1,200 that were born after. And we had a total of 44 cows that become infected during the study period. 33 of them were coming from the cohort of cow born before, and 11 of them were coming from the cohort of cows that were born after. So we can see now the three objective results, the final model that we use. For the first objective, the effect of cohort on MAP fecal excretion using a Cox model hazard model. So you can see on the you can see here that there was an effect, significant effect of the cohort on the fecal expression risk. So it decreased over here. You see the hazard ratio, and it was adjusted for the effect of the herds, of the clustering of the herds. So that means that in participant herds, the risk of fecal excretion of cows that were born after the enrollment was significantly lower by 52% than the risk of cow born before the enrollment on the program. For the second objective, we have looked the effect of the risk assessment score, so the questionnaire that were asked to the producer, and the risk, it was compared with the MAP fecal excretion. So again, we saw a significant effect of the risk assessment score. So in the low herd, the score that was lower, that means that they were doing good practices. If the score was higher, that means that they were not applying all the good practices. So you see that the risk is 2 times higher in the high score herd. So a cow born in a herd with a high risk assessment score was 2 times more at risk of shedding MAP than a cow that was born in a herd with a low risk assessment score. And finally, our third objective results model about the effect of calf rearing management practices on MAP fecal excretion. So you can see here that we found 2 factors that were influencing, that were significantly associated with the fecal excretion. So it was poor fresh cow cleanliness and contact between cow and calves. So that means that poor fresh cows hygiene and contact of calves with adult cows or their feces are risk factors significantly associated with MAP fecal excretion. It was found in other studies. It was not surprising, but in our context, we wanted to make sure that we had the same risk factor even if we had a tie stall herds. So in conclusions, we proved there that there was really a positive impact of the enrollment of farms on the voluntary program. Unfortunately, the program was stopped last year, but we proved that it was working. Significantly lower also incidence and hazard of individual fecal excretion of MAP in cow born after the enrollment of the program. So what the recommendation of their veterinarian was given to the producer, if they were applying it, it was working to decrease the risk of new infections. And the importance of fresh cow hygiene and to limit the contact between calves and cow is of utmost importance to try to decrease the risk of transmission. So it was confirmed in our settings also. And finally, changes in management practices reduce the fecal excretion of MAP, even in small tie stall herd like the ones we have in our part of the country of Canada. So finally, I just want to acknowledge the research team that worked on that project. And for sure, the PhD student, as I mentioned, Ron Carlos, who did all the work that I just presented to you. I want to also thank the dairy producer and the practitioners that were involved, and it was a long study. For 5 years, they were helping us doing this study, so it was very much appreciated. And also the funding from the government of Quebec and UPLE. Thank you very much, and with that, we'll be pleased to answer any questions.